Welcome to the Explainer. Today we're going to break down a condition called solitary rectal ulcer syndrome, or SRUS for short. We'll use some clear visuals to walk you through exactly what it is, what's causing it, and, most importantly, how it's treated.
So, if you're dealing with uncomfortable or, let's be honest, kinda alarming symptoms like rectal pain or bleeding, you're probably looking for some straight answers. Well, this explainer is designed to do just that, to help you understand what might be going on.
All right, we've got 4 main stops on our journey today. First, we'll cover what SRUS actually is. Then, we'll get into the symptoms and the root causes. After that, how doctors diagnose it. And finally, we'll look at the road to treatment and feeling better.
Okay, first things first. What are we really talking about here? At its heart, SRUS is a disorder that's all about the process of, well, having a bowel movement.
Now, this is the most important thing to hear right off the bat. Even though the name sounds pretty serious, SRSU is a benign condition, and that means it is not cancer. It's really a disorder tied to the physical mechanics of going to the bathroom, which causes some changes to the lining of the rectum.
What can make SRS a little tricky is that when a doctor looks at it during an exam, it can sometimes be mistaken for something more serious, and that's exactly why getting a correct diagnosis is so important, not just for treatment, but for your peace of mind.
So, what does SRUS actually feel like? And more importantly, why does it happen? Let's get to the why behind the symptoms.
You know, everyone's experience can be a bit different, but these are the classic signs. We're talking about things like bleeding or pain, that persistent feeling like you've got to go, or really having to strain when you do.
Now, these symptoms, they're not just random. They're actually the direct result of a core mechanical problem, something physical that's happening inside the rectum when you try to have a bowel movement.
Okay, to really get what's going on, picture a collapsible telescope, or maybe think about a sock turning inward on itself. When you're straining, the upper part of the rectum can actually fold down into the lower part. It's this repeated friction and pressure that irritates the lining and ends up causing the ulcers and other symptoms of SRUS.
And what's really interesting is, even though ulcer is right there in the name, studies show that's not always what doctors see. As you can see from this chart, most of the time it actually shows up as little growths, called polyps, or just as masses of red, irritated tissue. And this quote really drives the point home. The way it looks can be alarming, and that's precisely why a careful, thorough evaluation is so critical to make sure other conditions are ruled out and you get the right diagnosis. So how do doctors get that definitive answer? Well, it's not a guessing game. There's a really clear, established process to confirm if it's SRUS. The whole journey usually starts with a simple conversation about your symptoms and your habits. But the most essential step after that is an endoscopy. That's where a tiny camera is used to look at the rectal lining. And, this is the crucial part, take a tiny tissue sample, which is called a biopsy. Sometimes, other tests might be used to see exactly how your body is working during a bowel movement. That little tissue sample from the biopsy, that's the key. It's the decoder ring. Pathologists look for very specific microscopic signs, almost like a type of scar tissue in the rectal wall. That's the telltale signature that confirms, yes, this is SRUS. Okay, once the diagnosis is confirmed, everything shifts to treatment. And here's some good news. For the vast majority of people, the path to feeling better does not involve surgery.
The real goal of treatment isn't just about healing the ulcer. It's about fixing the root cause. If you can address the straining and that underlying mechanical issue, the rectal tissue actually gets a chance to heal itself.
So there are really 2 main paths for treatment. For most people, the main approach is non-surgical. We're talking about things like changing your diet, bowel retraining, and a special kind of physical therapy for your pelvic floor. The more invasive treatments, like surgery, are really only for very specific situations, like trying to control severe bleeding or fixing a major structural problem. And you know what? Research shows that these therapies are incredibly effective. They actually work by teaching your body how to coordinate those pelvic floor muscles correctly. This reduces the straining that causes that internal telescoping in the first place, which is why it's a cornerstone of managing SRUS successfully.
I really want to stress this point. Surgery is not the go-to solution for SRUS. It's only considered when there's a significant, deep-down structural issue with the rectum, like a really deep internal prolapse that just can't be fixed with therapy alone.
All right, let's do a quick recap of the most important things to remember. First, and I can't say this enough, SRUs is not cancer. Second,
It's a mechanical issue caused by that internal telescoping when you strain. Third, a biopsy is what provides the definitive diagnosis. And finally, treatment is all about non-surgical therapy and diet to improve how your body works. Surgery is rarely the first step.
Just understanding what this condition is, that's the first and most powerful step you can take toward managing it. Now you're armed with knowledge, and you can have a really productive conversation with your doctor to figure out the absolute best path forward for you.